Hi, this is Markeitha, and welcome back to Healthy Living. You can reach me at healthyliving.company, and at my website, there's several things there. There's Keitha's egg toast, Keitha's gumbo. The gumbo comes with hot water, cornbread, and rice. So I want to make that for you fresh. So please send me a message. You can also contact me here at the Next Level Studios, 310-549-1113, 310-549-1113. The producer of the show is T Jams. That's TJAMZ. And you can reach her at tjamsmusic.com. There you'll see a whole list of songs. You can write lyrics to them. You can send it back to him. He also does web design. So you can also contact him here at the Next Level Studios at 310-549-1113, 310-549-1113. Now, the coronavirus, I get a lot of my stuff from OSHA, CDC website. I do use the world meter for my updated on the statistics of the coronavirus. It's really, really bad. So as of today, we have a worldwide, this is worldwide now, 67,318,099 and 99. These are cases, deaths. We have 1,520,000 and 244. That is just way too much going on here. Now, the U.S. is the number one leader in cases and deaths. They have 15,123,438. And deaths we already passed that 250 a long time ago, right? It's 288,764. Now, Brazil is the second leading in deaths, but the third in cases. They have cases is 6,603,540. Now in deaths, they have 176,941. That is really terrible. Total of new cases in the world is 475,654, and total new deaths is 6,794. Now, the WHO, as you know, determined this a pandemic on March 11th. It started in Wuhan, China. At first it was deemed to be animal because they had a lot of animal open markets, but then they started spreading people to people. So now it's people to people. Coronavirus is a new coronavirus, and it is a severe acute syndrome, respiratory syndrome. Also, the MERS, MERS, that one is a Middle Eastern respiratory syndrome. And you know what? All these different coronaviruses, the flu is a type of coronavirus as well. They all came from bats in Wuhan, China. Now, this started in China, December 2019. That's why it's COVID-19, because of the year. But, I believe it started a lot sooner than that. China's not being that honest with people. So, anyway, we have to protect ourselves. You got symptoms ranging from mild to severe. It affects different people differently. You get fever, fatigue, cough, shortness of breath, chills, repeated shakes and chills. I heard they're really painful and violent chills, so they really hurt. Shaking with the chills. You also get headaches, body aches, sore throat, nausea, vomiting, diarrhea, congestion, runny nose, and new loss of taste and smell. Now, a lot of these symptoms are similar to the flu, so don't blow anything off at this point as flu. Make sure you contact your provider and go get tested. We should be tested anyway, so that then we know if you're positive now, then you can quarantine from people in the public and people in your household. Definitely don't gather outside your household. Make sure if you are in trouble, you call 911, let them know what you think your symptoms are, and they'll make sure that they protect you. Tell them you're having pain in your chest, you're having a severe shortness of breath, you're changing colors. Your lips are blue, gray, purple, any type of changing color. Now, who's vulnerable? At first, it was 65 over and people with underlying health conditions. Now it's just anybody. And nobody's exempt, even infants and babies. Conditions or risks of illness of the virus of coronavirus. Of course, it's more severe if you have underlying health conditions and you have the increased risk of being hospitalized and then eventually going to ICU and on a ventilator. So we're trying to avoid all that. So you got to make sure you protect yourself out there. Now, some of the diseases include heart disease, hypertension. You have asthma, COPD, which is chronic pulmonary obstruction disease, chronic kidney disease, sickle cell now is another added to the list. We have cancer, of course, autoimmune suppressive like HIV, leukemia. You know, if you had chemotherapy, you have to make sure you really protect yourself at that because of the therapy decreases your ability to fight things. Diabetes type 2 more than type 1. For some reason, they don't have enough research stating why it's not more prevalent in diabetes type 1, but it definitely is in diabetes type 2. But if you're diabetic, make sure you control your blood sugars. Smoking and pregnancy and obesity, especially if you're severely obese. That is a huge risk factor. So you want to make sure that you're eating healthy and you're exercising. A lot of people are gaining weight from being in home and isolated from the pandemic. But I want you to exercise. I'll show you some at the end of the show. Now, children have a different thing. It's called multi-system inflammatory syndrome, which kind of mimics, this was as of April 23rd, it mimics the Kawasaki disease. You know, you get the fever, you get the diarrhea, they can get body aches, they get this reddish, thick-looking tongue, the redness on the palm of their hands, their feet. Now they get an eye infection, you know, like pink eye, but then you don't see all the crust on the eyes. The crust is from drainage, so they don't get that drainage, but they get that redness or pinkness in their eye. Also, it can cause severe inflammation in all of their major organs like your heart and your lungs. Now, according to Medscape, the webpage, hospitals are filling up. A lot of patients are being sent home to care for the coronavirus because why? There's such a surge into the hospital that the nurses and the doctors cannot keep up. So this is why you have to protect yourself and stay home. Wear masks, wear goggles. Overall, weekly hospitalizations are at the highest point in the pandemic. Nationwide, even healthcare facilities they're becoming very overwhelmed. They're very taxed. You can go on the internet, even the news. You can see that the doctors and the nurses are overwhelmed, but who wouldn't be when you're dealing with people that are sick and that are actively dying and have died repeatedly? And in some situations, they feel like they can't even help them. There's something funny going on with the decrease in the hospitalizations when you have increased rise in coronavirus, right? So per Dr. Ashanki Jihad, MD, he's a professor at health services. He's also policies and practice. He's a dean at the School of Public Health at Brown University, Providence, Rhode Island. Now, he tweeted that the proportion of COVID patients getting hospitalized is falling a lot. So Dr. Jihad is right. More patients are being sent home who would normally not even be sent home several months ago. Because of the surge, they have to only keep the ones in the hospital that really need the oxygen support and the IV support and all of those things. Now what they're doing is they're holding patients in the emergency room, what they call observation area, and they can do that for 24 hours to give you hydration and any oxygen support that you may need at that time to get you more stable so you can go home. Now, per Dr. Delgado, unfortunately, we're also developing more experiences with who can be DC'd and monitored at home. What happens is this Dr. Delgado, he's a assistant professor of emergency medicine at the University of Pennsylvania, Perelman School of Medicine in Philadelphia. Now, this knowledge means that now it leads to precautionary hospitalizations, he said. Also, increased use of admission of observational status that is not required beyond the 24 hours, such as, you have to get them hydrated with IV fluids, intravenous fluids, right? So you can get that taken care of, monitoring their oxygen, and if they come to a stabler situation, then they'll tell you to go back home. So, and finally, the use of technology. They use the teleworking, they have post-ox, telemedicine, they have text messaging, and it's made it so that the care is a little safer to do at home. Though better data will come from the hospital because that's where you are. So there's not as many hospitalizations on record that it really should be because they're running out of room. The surge is too high. So this is very important that you protect yourself. But not everyone sees the shift in admissions such as, in a benign way. In Chicago, the hospital where he works, Dr. Delgado, is so inundated with sick patients that they're sending home elderly patients with COVID-19 pneumonia, which appear to be doing well when we had been hospitalized for 6 months ago. The person would have stayed inside. So per Victoria Foxworth, she's an RN, and she also states that response is recent, and we're also seeing an uptick in patients. We're also seeing patients with strokes. We're seeing patients with what we call a myocardial infarction, which is the heart attack where the blood is decreased to the heart, so then the tissue dies and you have a major heart attack. It is also one of the type of myocardial infarction, part of the heart muscle has died due to obstruction from the blood. So that's why you have a heart attack. That's a massive heart attack. So also surgeries of appendectomies are happening more. For some reason, people are having more appendectomy surgeries. They're getting more ruptures and pain where they have to have their appendix removed. So that's another thing. Do not stop your care that you need urgently. Go ahead, go to the ER, call ahead of time, but go. Don't wait. Never do that. I know some people are fear of going to the hospitals, but please do not do that. Now, Dr. Shannon McMillan in Massachusetts, based on gynecologist, surgeon, tweeted that she agrees with Dr. Jihad. I'm doing house calls for first time in decades because they are sending home old people that are very sick that do not have a safety net at home. They just do not. So as they send them home to die. They're sending patients home with oxygen saturations of 91% at home. That's why it's important for you guys to get your own pulse ox so you can also assess your pulse ox is oxygen concentration in your blood. Anything below 85 or lower, then that's a problem. So 95 is very close to 91. And this is when people tend to get in trouble and they die at home. Now, per Dr. Michael Merksner, MD, PHN, he's at the emergency room doctor at Mercy St. Francis Hospital in Mountain View, Missouri. He says, I confirm to you as an ER physician, at least in southern Missouri, we are sending home lots of people that will never have sent home simply because it's impossible to admit everybody to the hospital. So this is really dangerous for people. Please wear your mask, wear your goggles, keep your social distancing. Now, we still haven't really felt the total impact from the Thanksgiving holiday, so just be mindful that is coming. So keep into your own household. Try not to go out as much as possible. Now, per Dr. Jill Jensen at Chadwick, news director at the University of Kansas, the system of she told this to Medscape. I lose a lot of Medscape as well for updates and different medical things that are going on. They said there are frequent reports of tents and surge places being set up, but at this point, beds and space is not really the key problem. The problem is there's not enough staff to schedule to manage those ICU beds. So in Kansas, they've been hit with a 46% of hospitalizations across the state reporting staffing shortage. Dr. Chadwick said that one of the facilities that they work with, for example, has staff for 113 beds, but are licensed for 207. And that's because they don't have enough staff to staff all of those beds. So 207, what they're really staffing is 113 because of the surge. So staff are getting burnt out. Staff are also getting sick. Don't forget that. Staff get sick as well. And they're just really exhausted and overbearing. It's really difficult for us nurses and doctors to keep functioning to take care of you guys when there's a massive influx of surge. Okay, now also what happens is if one state or city fills up in their hospital capacity, then they move those patients to another nearby city, which also overloads those particular hospitals. So it's like it's a toss up. Oh, do you have a bed here? Oh, do you have a bed there? Oh, is there enough staff to even staff these beds? So it really isn't. So we really need you guys' help to uh, bring the surge down and keep it from continuing to rise. The hospital was 400 miles away, but they took that patient to that hospital because they didn't have the capacity at their hospital to take care of that patient. Now, also, there's with acute COVID infections, they have dropped slightly from 98 to a record of higher yesterday of 800, but now they're up again. So I just want you guys to know that it's just going to get worse, okay, because we still haven't dealt with the Thanksgiving surge. Now we have Christmas and New Year's coming up, so we have to hunker down. We have to start grouping up and going outside of our own household or inviting people into your household. You can't do that right now. And you know, with anytime there's a situation like an incident like Thanksgiving, it's going to take up to 14 to 21 days before you finally see the full effect of what happened from that holiday. Now, people with underlying positions have an increased risk of illness, as I stated earlier, hospitalization, admissions, ICU, intubation, and ventilation, and then eventually you can die from this. So you have to stop gathering up and you have to protect yourself. Now, updates. Adults of any age with the following conditions are increased risk for severe illness from the coronavirus. That's cancer, chronic kidney disease, COPD that we talked about, chronic obstructive pulmonary disease, heart conditions such as heart failure, coronary artery disease, cardiomyopathy, any kind of heart disease, myopathy, larger hearts, immunosuppressed state, weakened immune system. Also, if you had an organ transplant, obesity, moderate and severe obesity. That means that your BMI, your body mass index, is greater than 30 kilograms per milligram, per ems. So if you're if your BMI is 30, then you're at higher risk. If you're severe, that means that your BMI is even higher. So that increases your risk. Now, don't forget about pregnant women. Please don't be close to pregnant women. Don't walk up on them. Even this elbow tap, that's still not 6 feet away. So you don't need to do any type of touching at all at this point. Stay away. Also, sickle cell disease, smoking, type 2 diabetes. So, diabetes, but still type 1, still make sure you protect yourself. They don't have enough research to prove what's the impact on type 1. Type 1 diabetes is you're insulin dependent. Type 2, you can either lower your weight, and if you lower your weight and lower your A1C, which is the average of blood sugars over 3 months, you can eventually not even be type 2 diabetic. My A1C was crapping up. I was getting close to being a type 2 diabetic. So I was able to exercise, eat healthier, and get that down. Now, if you do have type 2 diabetes, make sure you're complying with your diet. Make sure you're taking your medication. You want to control your diabetes. Now, the next group that has severe illness that may get the coronavirus is asthmatics. Make sure you have your inhalers. You have your medication that helps to stabilize, your Singulair, or whatever it is. You want to control your asthma and you want to control your allergies. Cardiovascular disease, blood vessel supplies to the brain. That's what a stroke is. Cystic fibrosis, hypertension, high. You want to control your blood pressure. So whatever you have, make sure it's controlled. Make sure you do not run out of medications. Immunosuppressed, weakened syndrome, bone transplant, bone marrow transplant, immune deficiency, HIV. If you're using steroids, it tends to lower some of your immunes. So that's why the doctors only keep you on it for a little while, and then they start tapering you down depending on the dose that you started taking. neurology conditions like dementia, liver disease. Overweight continues to be a problem. Pulmonary fibrosis. Also, you know what? Thalassemia. Thalassemia is like a type of anemia. So thalassemia is a type of anemia. So what I take, because I have it too, I take B complex. That helps me maintain my red blood cell level within the norm. So if you have thalassemia, you should be taking B complex every day to control your anemia. So you don't want to be anemic. Also type 1 diabetes. So there is any diabetes, really. Just look at it that way. Any diabetes, make sure you're controlling. Children, now they are at risk too. And remember, it's a little bit different. And I'll talk to you about the Kawasaki type syndrome, where the children are associated with it and increasing their risk too. They have increased risk factors like severe illness they have obesity, medical complexity, severe genetic disorders, severe neurological disorders, inherent metabolic disorders, sickle cell disease, congenital does mean you were born with a certain abnormality. So congenital diseases, chronic kidney disease, asthma, other chronic lung disease, immunosuppressant, malignant or immune disease, weakening medications. So everybody's at risk, right? So no one's exempt at this point. No one. So you have to protect everybody. Now, how do we reduce the risk of getting COVID? It's especially important that people increase in order to decrease the risk. If you're exposed to someone who has COVID positive, make sure you quarantine and get tested. So you want to stay away from those people. Make sure you only deal with the people in your household and not go outside of your household. The best way to protect yourself is to help reduce the spread of the virus caused by COVID-19. Now, limit your interactions with other people as much as possible. As much as possible. Now, I'm going to show you some different things that I want you to know about, which is proper masking. I see so many people wearing a mask and they're not covering their nose. You have to cover your nose as well as your mouth. Doesn't matter, I'm going to show you. This is a regular mask a lot of people wear, right? So you want to make sure that your nose is covered. You can just pinch like this to make it fit around your nose. But if it's under your nose, you're not doing any good. You can get the coronavirus from exhaling. So you have to cover your nose. Do it properly. Now, there's different ones out there. We also have the K95s, which is what you can get when you order, right? So you can wear those K95s, and you still want to make sure you push here so that it fits closely to your nose so less things can get into you. Now, the nurses, we have what we call an N95. So we're fit tested for our mask to make sure it fits us. All healthcare workers, doctors, nurses, we wear these. So these are reserved for us because we're the ones who are in direct contact with the potential virus. Make sure you wear gloves when you go out, because touch is a big thing. So you want to wear some gloves. Now, the other thing that I want to tell you is get you some goggles. Okay? You can get some that are fog free. You can also get the spray that you can spray on it to help them be fog free. And you want to get the kind that are not a direct vent, meaning open on the side, because see how it encloses here? You don't want that. Or an indirect vent, meaning it won't let the virus go into the eyes. Now, also, I'm going to show you how to make a mask if you don't have a mask, or you can't afford to buy a mask. That's okay. I'm going to show you. Let me take this one off. And when you're out, you want to make sure that when you come home, you don't touch your mask and you don't touch your goggles until you wash your hands first. Okay? Because then you want to contaminate your mask. Now, let's get back to making a mask. So you can just get any little square piece of material. You can use an old t-shirt and cut it out, right? And then you fold it in half. And then you bring up the top portion to the middle. Same with the other side. And depending on how large your face is, depends on how much you fold it, right? Then you get a rubber band or elastic hairband. Put it on each end. Fold it over. Here's the second one. Fold it over, right? So you fold it over, and then what you do is you grab the bands. So here we go. Right? A mask. Voila. You can do the same thing with paper towels. I did this when I was out and about and saw two women with no mask on. So I went to the bathroom. I got several layers of paper towel. I did the same thing, so you can make the same mask with it. So even if you don't have any old cloth laying around, you can still make a mask with paper towels. Just make sure you have it thick enough. You want, 5 layers is good. So you want to make sure that, so then you turn it over. You do it the same way. You put the rubber bands on the end. In the office, when these two people didn't have the mask on, I got rubber bands from the clerk. So we use rubber bands. So you do the same thing, and depending on the size of your face, the size of your face depends on how close you fold the napkin. So there you go. So there's no excuse not to wear a mask. None. There's no excuse. And this is what's causing all of these surges, is because people are not wearing masks and keeping social distancing. Now, there's also face shields. So, put on the mask. And you can get a face shield if you want. We as healthcare providers, we do wear face shields. We have gargles. We have gowns, water-resistant gowns that we have to wear, right? So this is what we have to wear. Now, there's different types of goggles. I don't care what kind you get. Just cover your eyes. But don't get the kind that has direct vent, meaning holes there so that the virus will go straight into your eyes. The virus does enter into the eyes, so we need to have eye protection as well. So get you some eye protection. Like I said, the best kind is to get the kind that's fog-free, so you don't have to worry about them fogging up as much. Okay? But we gotta wear masks. Family and friends, tell them, put on a mask. This is why we're where we are. Now, I did a show last week on how far the virus goes. It can go up to 22 feet. So, depending on the weather, depending on the wind speed, it travels this way, and up. So, you want to check my previous show so you can find that out. So, take precautions when you interact with others. If you're starting to feel sick or think you're sick, stay away from people. Go get tested. But we should all get tested so we know our COVID status. Consider before being around people. This is what you should consider. There's no way to ensure that you have zero risk of infection. Even if you test negative today, you can be positive tomorrow. So that's not a guarantee that you're negative today. Infection, so you shouldn't be just running around and don't wear masks. And I see people on the news all the time that don't wear masks, but they're complaining that the restaurants are shut down. Where's your mask? It's you're the reason when things are getting shut down. Wear a mask. That's what you can help do. Right now we're on stay-at-home orders and we should not be gathering at all. There was sometimes you can see on the internet where people had died, where they went to visit Aunt Sally. Come to find out, Aunt Sally had COVID. So then that whole entire family that came to visit Aunt Sally, the father died, the kids got COVID, and the mom is struggling with COVID at this point. So it affects everybody differently. So just because you see somebody gets over it really quick, it's going to happen to you. So you should always ask people if they're sick. coughing, sneezing, runny nose, congestion, all that stuff that sounds like the flu, right now, consider it COVID until you're tested and it's not. People at increased risk, like I said, are people who have the underlying condition, but everyone can get COVID. So don't think you're exempt because you're not. And a lot of times it's the younger people that get COVID that are asymptomatic that come home and pass it on to older people or young people who have underlying conditions. So you can be a super spreader and you don't even know it. That's why everybody has to wear their mask and goggles. No gathering, like I said. I don't care if it is. I know you love your family and I know you miss your family. But this year, you have to love them from afar. You want to love them enough not to gather and not to potentially give them the coronavirus because you don't know you have it. So love your family enough to keep your distance. The more people you interact with closely, this increases your chance of getting COVID. Especially if you're not wearing a mask. Okay? And you're not keeping... Me, I want to be 12 feet or more away because the sneeze and the cough can travel up to 12 feet in 50 seconds. So I'm not all with that 6 feet. I want to get further away. Now, you want to keep your mask with you. Have backups in your car in case one breaks, or put it in your purse or your pocket. You want to always have a backup with you. So if something happens, you have another one you can pull out and put it on. You want to wash your hand with, take a bottle of hand sanitizer with you. It has to be 60% or less. The important thing is to make sure you keep rubbing your hands until it dries. Don't just rub it a few seconds and it's still wet and you wipe your hands off. You don't want to do that. You want to make sure that it dries, okay? If you don't have that, you can get a wet towel. This is what my husband does. I think it's a good idea. He soaks it with antibacterial soap and he puts it in a plastic bag. That way, when he gets back in, he can use the rag to clean his hand. Because we have what? Lysol, Clorox wipes that are short demand. So this is another way you can protect yourself. Okay, so there's no excuse why not to wash your hands. Now, if you see somebody out, encourage them to wear their mask. If not, then you make sure you get the hell away from them. Because they don't have their mask, they don't care about their safety, and they don't care about yours. So you want to get away from them, okay? Now, reconsider, like I said, visiting family and friends. Another young ones want to gather for Super Bowl games or whatever, playing games on their PlayStations or whatever. It's not a good idea to do any of that. Like I said, a lot of people were in line for hours before they went and got on the plane because they wanted to have a negative status. Well, you did that day, but you went on the plane with a whole lot of people for a lot of hours. So then, yeah, you could have got it again. So by the time you got to your destination, you could be a super spreader with your family members. And that's why they say you got to quarantine for 14 days when you go around people. No enclosures. That's what a plane is. That's why the CDC said stay at home, cancel plans. So now we still got to wait for the true effect from the Thanksgiving. Now, delay or cancel the visit, period. It's not good to gather. I don't care if there's your loved one, because guess what? Loved ones are dying. Okay? And loved ones get sick. We've had one family, I think it was a family of 9 or 12, and they all got COVID. And the older parents and I think grandma, I think 3 out of 6 died. So was that a good, loving type of gathering? No. People died. They're not there anymore. Remember that. People die. Just because it hasn't hit your family yet doesn't mean it's not existing. It exists. Don't wait till it hits your family. That's what we're trying to tell you. Protect yourself. Now, if someone is having symptoms in your household, they need to quarantine for 14 days. If you're lucky enough to have 2 bathrooms, let them use that front bathroom and they're to stay in their room at all times. They have to wear their masks. If they do come out, let us know. We clear the room. But you have to quarantine if there's symptoms. Don't blow it off like it's flu. Take care of yourself. Stay in there for 14 days. So if you go out gathering and you want to come back home, you got to be quarantined for 14 days. And it's not easy, but that's what you have to do so that everybody else in your household doesn't get exposed to the COVID. That's why at the airport they told you if you take off, when you come back, you got to quarantine for 14 days. But what happens is when you went to the airport and you flew, say, to Dallas, you didn't quarantine yourself for 14 days from being with that family member. You could have just gave them the coronavirus. So that is really sad, and that's what's happening. You want to think about how many people you interact with. If you go gather, make sure you write who you were with, the date you was with. So if you do get coronavirus, they can do the contact traces that you had to help protect other people. Okay? And this is based on the science. Now, if, like they recommend for Thanksgiving, if you're going to have a gathering of family, no more than 2 or 3, but outside on the patio, so that there's free flowing air, and if you're eating, you have to take your mask off, right? But keep your distance. Keep your distance. But right now, no one should be doing any of that. Make sure you encourage social distancing with friends and family, even if you're outdoors. And this is why they shut down the outside eateries and restaurants for that reason. Because what? It travels. It travels across. It travels up and down. So just because you with your own table, it can still travel to the next. I know people are not happy about it, but get on your senators to approve a bill so we can get financial support while this is going on. So that's who you need to be picketing on, is your senators, to push this relief money, not the governors and the people who are trying to keep you safe. Now, also, tables and chairs allow social distancing. People in the same household, you can sit together. But if you're outside, like I said, we're not doing any of that. So I'm not going to talk about that right now. So keep your distance. You don't want to be gathering for sporting events. You definitely don't want to be drinking. What happens when you drink? You forget everything. You're all up on people. You don't have your mask on, and you get COVID. This is what happens. And it's a congregate setting, meaning it's an enclosed area, and it has bathrooms and stuff like that. That's what that is. Those are non-residential congregate settings. So you should not be anywhere enclosed with a group of people at all. No handshakes, no bumping elbows. Instead, just wave at them. Oh, hi. Oh, okay, I'm sending you a hug from a distance, right? Always wear your mask. And remember, cover your nose. You should not have your mask on under your nose. Because when you exhale the coronavirus as well. That's just proven science, and you don't believe it, you can go look it up. You get it from exhaling, talking, singing, and on top of coughing, sneezing, and all the other things. But you can't get it from exhaling. And then on top of that, you can breathe it in. People tend to take their masks off when they talk. Why? You can hear me. I have a mask on. It has nothing to do with it. Forget about the old ways. They don't need to see your lips moving. They hear you. Leave your mask on and cover your nose. Keep your distance. Now, that's the most important about that. Now, if your mask, the reason I want you to keep an extra one too, in case the rubbers break, or if they become wet. If it becomes wet, then you need to change your mask because it's not protecting you any longer. If it's a cloth, if it's one of these, throw it away. If it's a cloth mask, you can wash it. But always take a backup so you have it with you. Because you never know how long it's going to take you to get back from where you went to. Because even the grocery lines are long. So have a backup mask with you. And no matter what, the supermarkets, people are in line. You really got to remember to keep your distance. You have to. You have to remember that. Keep your distance. And remember, I also say you should wear your goggles. So, it's been proven in research that the coronavirus can enter into your eyes, eye membranes with this conjunctiva. So also get the clear kind because you can see. You can see right through it. So get the clear kind. Don't try to be cute and get this shaded in. It's not clear. You can also fit your glasses over the goggles. You can get that kind too. So it fits over your glasses. Then you still have that protective layer there. Now, people say, oh, I have on glasses, I'm good. No, you're not. You're not good. That's not eye protection because glasses, regular glasses, do not have that protective barrier on the side that keeps the COVID from entering into your eyes. And it's opening spaces there. So eyeglasses are not protected eyewear, nor is contacts. They're not protected airwear. Only goggles. So that's what you have to get. Now, like I say, we usually like to see the lips moving. Well, you can't see the lips moving. You can't see them smiling. But you can see it in their eyes. Right now, you got to wait on that because we're not doing that right now. You have to cover your nose, cover your mouth. Now, people who should not be wearing masks, of course, children under 2. And even if they're 2 or older, they won't keep the mask on. So while you're at home, you need to practice with your kids to wear a mask. So when they're outside, then they'll keep it on. Because a lot of times kids take it right off because they're kids, right? So you have to show them and start practicing with them at home to keep the mask on for their protection. If you don't practice with them when it's time for the mask, they're going to yank it off. So parents, practice with your children so they'll be prepared and they'll be ready. If a person is unconscious or incapacitated, you can't put a mask on them because they can't remove it. Wash your hands often. My hands remember, you got to remember they get dry and cracky too. So you want to make sure that you apply lubricant on your hands as well to keep your skin lubricated because you don't want cracks in your skin. When it's dry, it cracks more, especially with you diabetics. Check your feet. Make sure you're wearing closed-toe shoes. Inspect your feet every day, even if you have to get a mirror, because you tend to have decreased sensation in your feet and you don't feel it. So you can be walking around with a nail in your foot and never know it until you have this massive infection and then it's too late. I don't want you to lose your feet or your toes. So check your feet every day and don't walk around without your feet covered. So when you wash your hands, it should be at least 20 minutes while you're washing and doing friction. Okay, so I'm gonna take a break, and when I come back, I'm gonna show you some simple exercises that you can do lying, sitting, and standing. Like, damn, she's jacking us up. Hear it. Turn it off. I'll tell them about the zinc and all that stuff. Okay, hi you guys and welcome back. So I promised you some exercises to do. So we're going to start with the couch or lying. So if you're new at this, you can put your back to the back of the couch and then you can do your sit-ups and then come back. I usually work the arms too because the more you work, the better. When you get a little bit better, you can slide down some. Always hold in your tummy when you're doing your exercises. Don't use your neck. You want to use your abs, okay? And then when you get better, you can go all the way. Come up, right? Hold your abs in, right? Okay. Now, let's do some exercises. You can do lying down. So if you're not used to exercising, you can get these resistant bands to kind of help you move it up a little bit until you get used to exercising. So you can use the band to help pull your leg up if you need it, if you're not used to exercising. Otherwise, you don't need the band, and you can pull them up. Then you can pull them up together, right? Always holding your abs in. You can also spread them apart. You can do scissors on the ground, and then when you get more advanced, you can lift them, and then you can cross them. Hold your abs in the whole time through 3 sets of 10s. Now, if you can do more, fine. You're going to feel it if you're not used to moving. Now, let's use the resistive band. You tie it. You can put it right above your knees. You can use this one for 2 things. So, when you're on your back, you can put it here, and then you can open and close. This is good for this inner thigh right here. This puts some resistiveness in because of the band. Now, if you're not used to it, then do it without the band. Now, another thing you can do while you're laying in this position is you can also do the same thing with the closures and the scissors, right? Always hold your ab in. You want to use your ab and not your neck and your back, right? Now, another thing you can do while we use the bands, you can turn on your side, and what you're going to do is, remember, you got to roll your hip forward. So your hip has to be forward. So I usually put my hand there, and then I know my hip is forward. And then your knee, your top knee is a little bit further over than your bottom knee. So then you can put your leg out. You can hold it for a count of 10 or 3 sets of 10s or 30, or you can go up and down. Also, you want to make sure you can go to the back. Remember to make sure that hip is over though, right? And you can do the same thing. You can hold, which is isometric. You can hold it for 10 seconds, 3 sets of 10, or you can go up and down. Now, also be mindful that you got to do it on both sides. Okay? Do the right and the left. Now, another thing you can do while you're on your back, you can put your palms straight down and you can do pelvic lifts. Right? You can hold it for a count of 3, hold your abs in, or you can go up and down for 3. Now, when you get a little bit more advanced, you put your feet together. You can hold yourself up while you're sliding down. Hold yourself up, hold your abs in. Now, that really strengthens your core. So you can do that when you get stronger. Again, you're going to do the bridge. Hold your ab in. And slowly let your feet slide while you're holding yourself up. Okay? That's a little tougher, but when you get advanced, you can do that. Now, another thing you can do is put your leg to the side. This is really good for the back. If you can't go all the way, then go where you can go, right, until you can get where you can go. Because you don't want to turn. You want your leg to go to the side. It's also another way to stretch out your muscles at the end of your workout. You can do that as well. So if you can't go all the way, go where you can go, right? Especially if you're not used to exercising. This is a good stretch for right here in this inner thigh. Now, another thing you can do, put them both together. I love this one. This is great for the love handles. I love it. You know that big extra fat that's usually right here rolled up on the side? Oh, this is good. So you can go where you can go, right? Until you can go all the way. So you want to make sure you do both sides. Remember, everything is both sides. And if you can't go all the way, go where you can go. Everything is 3 sets of 10. If it's really hard on you and you're feeling it already, then you can do 3 sets of 5. Okay? Now, this is another good way to stretch it out at the end, because you can feel it on your back when you do this. Right? You can feel that. That is just fantastic. Now, another one you can do, you can turn over. Now, a lot of ladies are worried about that back fat, right? Okay, this is a good one. You turn over, and you want to lift your feet up to your back. If you can't go all the way, or if you have knee problems, go where you feel the pain. Do that. And then if you can't, then go all the way till you can, right? But if you have knee problems, you can only go probably maybe about halfway. Then do that. But that's for the back, your buttocks, and the back of your thigh. You know, we have those moon craters back here. That's a good exercise for that one. Now, okay, so now we're going to move to standing. So there is several standing you can do. And I'm going to show you. Now, one that I do like when I'm brushing my teeth, you know, you do your lifts. You lift up to the ball of your feet, right? Now, if you're not used to it yet, then you can do the little lifts. Okay, hi. So we had a power surge there. We can't control the power. But anyway, you get the gist of the show. You want to exercise. If you get stressed, you don't want to just eat. If you want to eat carrots, celery, you know, fruits, vegetable type things so you don't gain excess weight. Stay away from sodas and everything. So that will help keep your weight down. Now, what I want you to know is, okay, so we had a slight power surge, so there's nothing we can do about that. But, you know, keep the exercise. Make sure you eat healthy snacks if you are stressed. Get some carrots and ranch and, you know, fruits or vegetables. Eat those type of things if you're stressed. Or just exercise if you're stressed. It's more healthy for you. Now, what I also want you to know is there's ways to build your immune system. You can take the vitamin C. You can take zinc to help build your immune system. Also vitamin D, and usually with calcium it comes together, so then you can help protect your bones. Also B complex I take every day. I mentioned that to you guys, especially if you have thalassemia. Help keep your red bloods going and everything. And if you're having problems sleeping at night, you can take melatonin. Melatonin is a natural way to assist you with sleeping. The best thing is uninterrupted sleep. That's the best sleep because your body needs to regenerate. So that's what that is. Also, there's food products like almonds and cashews, and you can eat blackberries. You can also have broccoli and avocado. Now, one thing coronavirus is doesn't like acid, so you can eat lemons, limes, orange juice, pineapple juice. It doesn't like all that acid, so you can do those things as well. Make sure you gargle in the mornings when you get up, when you brush your teeth, and gargle, clear your throat, cough, clear your throat and gargle and spit all that crap out. Do that every morning. They have research that's proven that mouthwash helps to get rid of some of the coronavirus. So keep that and develop that same type of thing. There's also ways you can clear out your sinuses. I use the nasal med to wash my sinuses out. It comes with individual packages, and it shows you a line where to fill the warm water. You don't want to put cold in unless you like cold water. Otherwise, your nose is going to feel that too. And you just hold it, and hold your face over the sink, flush your sinuses out. You get to sneeze and get rid of all kind of good stuff. Well, actually bad stuff, so you'll feel better. Want to make sure that you wash all your items when you come in from stores or get packages from the mails. Wipe them down. You can make your own bleach spray. Get you some bottles. Use 1/3 bleach, the rest water. That's your own bleach spray, so you don't have to keep buying bleach, which is in short demand. Also, you want to clean your keys, your cell phone, because there's a lot of touches on the cell phone. Use that several times a day, so you want to keep that clean. Also, washing money. Wash your money. That'll help you with that as well. Now, so just protect yourself. Make sure you wear your mask. Make sure you wear your goggles when you go out every time. And make sure that you're wearing your mask properly and not taking your mask down because you want to talk. They can still hear you. Leave the mask on. Cover your nose. Fit it to your nose. Put on your goggles. Keep your distance. Stay safe. Don't be grouping up, going to see family, making them sick and maybe possibly die. You don't want to live with that either, that conscience. So stay at home. Don't gather. Wear your mask. Wear your goggles. And I'll see you in a couple of weeks. So my website is healthyliving.company. You can go there. If you missed the show, tell your friends and family to watch it anytime by clicking on the previous shows. The producer of the show is TJams, TJMZ. You can reach him at tjamsmusic.com. He does all the music you hear on the show. You can go there. There's a list of songs you can write lyrics to. He also does web design. So you can contact us both here at the Next Level Studio at 310-549-1113, 549-1113. And exercise and stay safe. Wear your mask and goggles. I'll see you in a couple of weeks. Okay, bye-bye. Stay healthy. Bye-bye. Exercise. Yeah, exercise. It's good for you. It leaves you rest. Keeps you from gaining a bunch of weight.